Good afternoon. The title of my paper is Hydissect, New Surgical Technique in the Management of Complex Posterior Polar Cataract. We do not have any financial interest in the subject matter of this presentation. Friends, you know that posterior polar cataract is a surgical challenge due to its associated high incidence of intraoperative posterior capsular disruption. The routine phacoforces or any attempt to detach the cataractous plaque may lead to complete pre-extraction disruption of the posterior capsule, and the incidence has been reported from 36 to 40% by most of the leading ophthalmologists. There are several techniques which have been described: slow motion phaco, step-by-step chopped in situ, lambda sculpting and cracking technique. So all these techniques, they work very well in a simple posterior polar cataract. Simple posterior polar cataract means where the posterior capsule is intact. It is fragile, weak and brittle. It's adjacent to the posterior capsule but not defective. No extension of the anomaly into the nuclear complex, and there is a preventable posterior capsular disruption. But what about the treacherous complex posterior polar cataract with posterior capsular anomaly? It means there is the posterior capsule is firmly fused with the cataractous plaque. There is a pre-existing capsular defect or hole. There could be segmental or complete agenesis of the posterior capsule. There could be anomaly which is extending into the epinuclear complex. And in no way in all these cases you can prevent the posterior capsular disruption. Posterior capsular disruption has to take place in all these cases. So the purpose of the study is to describe efficacy of a new surgical approach, Hydissect, in the management of complex posterior polar cataract, and minimizing the further disruption of the posterior capsule and prevent the posterior segment complications, and in preventing pre-extraction posterior capsular disruption. We took 22 cases of posterior polar cataract from our center in Delhi. On the basis of clinical examination, these cases were grouped into two simple and complex posterior polar cataract. We took up all the complex posterior polar cataract into our study. Preoperative evaluation was completed with biomicroscopy, anterior segment OCT, and specular microscopic examination, fundus photography, FFA, and the posterior segment OCT. The surgical approach in all the cases, in all the 10 cases, was taken place with the Hydissect technique. Hydissect means it's a bimanual irrigation and aspiration cannula controlled dissection, separation, and extraction of the cortical matter, epinuclear membrane, and polar cataractous plaque with simultaneous posterior capsular axis and without using the phaco probe. So this is the technique I'm going to show you here in this video. So we need to do a good capsular axis. The capsular axis has to be a little smaller than what we normally plan for the normal cataract. You should avoid cortical cleaving hydrodissection. I'm doing here multi-segment hydrodissection, means you are injecting very small fluid all around, and then using a low phaco forces, low energy, and low stress on the posterior capsule, you are segmenting the nucleus into two segments. And this nucleus, after segmentation, is emulsified with a very slow process without any haste, and then using the bimanual technique. Now you can see here, because I am using the irrigation and aspiration cannula and aspirating the cortical material first without disturbing the center plaque. Now this is called as the segmental technique, like you are taking out the cortex and segmenting it away from the center 3 millimeter. So this is how you can see now. This is the plaque which I have left finally to support the posterior capsule. And then finally I am going to take out this plaque slowly, and you can see the plaque is now being taken out with the help of the aspiration cannula. You have to be very slow and controlled, and at the same time I'm putting the traction on the posterior capsule, like trying to separate this plaque from the posterior capsule and tearing the posterior capsule slowly with the help of the aspiration cannula. So you can see very slowly I'm trying to remove all the plaque and removing it from the posterior capsule slowly. And then finally what you can see is there is a posterior capsular rhexis which has happened along with the removal of the plaque. Now this is followed by the completion of the remaining cortical and epinuclear material which is there in the sub-incision area. And once you complete, your surgery is complete, you protect the posterior segment complication. So in 17 cases, the complex posterior polar cataract were 45% in our study. Most of the cases were between 20 to 40 years of age. This was their data. And what we have seen is in all out of the 10 cases, the 9 cases where we could make a successful PCC. The vitrectomy was required only in 1 case. In the bag,
Sir,
IOL was put in all the cases
your time
except
is
1
up,
case.
sir.
Please
And,
conclude.
the vision was removed, and to conclude, the Hydissect bimanual low vacuum controlled aspiration of the cataractous plaque while creating a controlled posterior capsular axis is the most suitable surgical approach in the management of complex posterior polar cataract. Thank you.